Thank you, Chair Murray. And I want to welcome Dr. Murthy and Dr. Levine to the Help Committee. It's good to see both of you again. I want to turn our attention, perhaps not turn our attention, we've sort of been speaking about this already, but to the issue of health disparities, which I know both of you have worked to address throughout your careers. Back when I served in the House of Representatives on the Energy and Commerce Committee, we had a series of hearings on health disparities. These hearings were shocking and perhaps part of the early stages of us as a Congress trying to tackle health disparities that exist. And I'm recalling in multiple hearings where we would have a panel of expert witnesses talking about the health disparities that exist, talking about possible ways to diminish these disparities. And I would often ask this panel of government experts or academic experts, what can you tell me about health disparities affecting the LGBTQ community? And the response I would often get is stammering and muttering and we'll have to get back to you. The Institute of Medicine ultimately did a very profound study on gaps in knowledge and a set of recommendations to how to close these gaps in our knowledge about health disparities impacting the LGBTQ community. Dr. Levine, based on your experience as a state health official, what should the federal government do to support state and other efforts to better prioritize and address the health needs of people in the LGBTQ community?
Well, Senator Baldwin, thank you so much for your question, and thank you so much for your work on this issue. Health equity is a critical aspect of our approach to COVID-19 and really to all health issues. COVID-19 has certainly shown us the challenge in healthcare disparities that we see in our nation, and that would include the LGBTQ community. In Pennsylvania, we have had an annual LGBTQ health assessment, which has given us very important data about the community. In addition, we are the only state that is collecting sexual orientation and gender identity data in terms of COVID-19 testing. And I think this brings up the point of the importance of data. It is critically important that we include questions about sexual orientation and gender identity in our data collection. That would include many studies done by Health and Human Services and the CDC. And I think that as we get more data, then we understand more about these health disparities, and then we can develop the appropriate policies in order to address them.
Well, I really appreciate that. I want to pivot to the opioid and substance use disorder epidemic. It's certainly one of my top priorities, and it's also a top priority for many members of this committee on both sides of the aisle. Unfortunately, the ongoing COVID-19 pandemic has exacerbated challenges in our response, and I'm deeply concerned about reports of data of increased overdoses and other harmful effects of this crisis. This is to both Dr. Levine and Dr. Murthy. As Surgeon General and Assistant Secretary for Health, what would you prioritize in our response to the opioid and substance use disorder epidemic, including to make up for lost time, lost ground over the past year?
Well, Senator, thank you for this question. It is very, very important. The opioid crisis has been with us for a number of years, and it has worsened, as you mentioned, during the COVID-19 pandemic. In Pennsylvania, and as Physician General and Secretary of Health, I concentrated on this. We worked on prevention, on rescue with naloxone, and an expansion of treatment, particularly medication-assisted treatment. If confirmed, I look forward to working with Dr. Murthy and SAMHSA and other experts on making sure that we fully address the opioid crisis.
Dr. Murthy?
Thank you, Senator, for that question. The issue of opioids and the opioid crisis is certainly near and dear to my heart. It's an issue that I focused a significant amount of attention on when I was Surgeon General last time. And as a clinician, as a doctor, I cared for many patients in Massachusetts and in neighboring states, including New Hampshire and Maine and Rhode Island, who struggled with issues related to opioids. I think in the 2016 report that I issued on alcohol, drugs, and health, I had laid out a number of steps that we can take as a country, not only to address opioids, but the larger crisis of addiction. But I still feel that there is important work we have to do, given exactly what you said, that overdose deaths have not gone down. In fact, they have gone up, especially over the last year. And I think we still have more we can do to expand access to naloxone. We still can take steps to expand access to treatment, not only making medication-assisted treatment more available by integrating it into primary care, but by making it easier also for clinicians to prescribe to their patients when they feel it is needed. But I also, Senator, feel that we can do more to invest in prevention. We detailed in the 2016 report a number of programs, including school-based programs, that provide an extraordinary return on investment in terms of reduced healthcare costs, economic losses, and criminal justice costs, with relatively modest upfront investments. I think a lot of those programs are still not well known. They're certainly underinvested, but these are places where I think a little investment can go a long way and can ultimately help save lives.